Hello, everybody. This is Ed Pavlik. I'm in Lexington, Kentucky. My colleague is here.
Frank Lawton from London, United Kingdom.
Okay, we're giving you another edition of Gynec Garage, which is a look under the hood at different publications. And we do this monthly. So we maybe not have improved over the months we've been doing it, but we still do it monthly. The paper that we want to consider today is a paper about the risk of endometrial polyps, hyperplasia, carcinoma, and uterine cancer in women who've received tamoxifen therapy for breast cancer. The paper appeared in a very good place. It's confined to the South Korean population, and it has a very significant number of people that have been considered. The long and the short of it that makes it worth mentioning is that it sort of, in my mind, is more definitive in dealing with the premenopausal population who were treated during their premenopausal or young years for breast cancer with tamoxifen. And roughly, really, what they show is that the hazards ratio for these women of developing endometrial cancer is just over 4. And if you separate it into 2 age groups, those who've been on, or 2 treatment duration groups, those who've been on tamoxifen for less than 5 years and those for over 5 years, there is an increase in the hazards ratio relative to treatment duration. Now, the medical community has dealt with this issue for some time, so most people might say, well, we know that tamoxifen treatment runs a risk because the recommendation is that really 5 years of treatment duration is sort of more safe than longer, and recommendations now would have people treated or have women treated with our aromatase inhibitors after 5 years on tamoxifen. Anyway, I think this really does answer a paper or 2 papers that are out there that said that premenopausal women treated with tamoxifen did not have to worry about endometrial cancer. And I think this paper is significant in the sense that it says, no, we think they're at really the same risk as postmenopausal women based upon the duration of treatment with tamoxifen. Frank, what do you think?
Yes, it's an interesting paper. I've just looked at it fairly recently, and I think it is aimed probably not at gynecologists who obviously wouldn't be looking after patients with breast cancer. But I think for radiation oncologists, clinical oncologists, medical oncologists to be made aware that premenopausal women who have an irregular or an abnormal bleed, it is not normal. And that should be an indication for at least a vaginal scan to determine endometrial thickness or whether there are any polyp abnormalities and things like that. So although it may be not news to the gynecology people, I think it is something that, particularly in premenopausal women, it's something that physicians should be made aware of. The other problem, of course, is that there is a link between breast cancer and endometrial carcinoma anyway, regardless of whether you're being given tamoxifen therapy. And I hope radiation oncologists know that as well. But this is an extra thing, I think, saying, well, okay, yes, we know you've got an ovarian cancer, but an endometrial cancer, but there may be some endometrial problem as well. And so I think that's why it's an important paper, I think, just to make sure that people are aware that the risk for the young woman with breast cancer on tamoxifen is exactly the same, possibly even higher than that for postmenopausal women.
Sure.
We've known for a long time that tamoxifen is an anti-estrogen in the breast, but it is an active estrogen on the endometrium.
Yeah, just what you say, taking the option of women that are younger are not going to get endometrial cancer from tamoxifen off the table and including them in the surveillance group, is reason enough to believe that this paper is dealing with some significant findings.
Yes.
Well, very good, Frank. We've done it again. Zoom has allowed us to come together.
Absolutely.
And it's good to see you again.
Yeah.
We'll continue this next month.
We will indeed.
Okay.